Before we make a start, I would like to acknowledge Aboriginal and Torres Strait Islander peoples as the first Australians and traditional custodians of the various lands that we're all joining from today. I would also like to pay my respects to elders past and present and extend that respect to other Aboriginal and Torres Strait Islander peoples who might be joining us. So I'm Meg Finch and I'm joining from Awabakal lands, and on behalf of the National Centre of Implementation Science, it's my pleasure to welcome you to our webinar this morning. So we have a really good lineup of speakers who'll be sharing their insights from work in knowledge translation and prevention research. And because we've got so much exciting content to get through, I'm just going to do a really brief intro. So I'm delighted to welcome Professor Wolfenden, Maddie Heenan, and Dr. Alex Chung, and also Professor Rebecca Golley. So just before we do start, I'll let you know that after the presentations, we'll be holding time for questions, so that'll happen at the end. We'll be taking the questions via the chat function, so please feel free to add to these as we go along. Towards the end of the session, I'll also be posting a link to a really brief evaluation survey. So if you have time to complete that, we'd really, really value your feedback on the session. So that's all from me, so I'm very delighted to hand over to Luke.
Hey, thanks everyone. Sorry, just grappling with this screen. I'm delighted to be here to present today and very much looking forward to hearing from the other presenters. So my name is Luke Wolfenden. I'm Professor of Public Health at the University of Newcastle and Director of the National Centre for Implementation Science. I also wanted to just start by acknowledging the traditional owners of the land that we're meeting on today and paying my respects to elders past, present and future. So today I'm talking about dissemination and how it may be better undertaken to improve its impact on public health policy and practice. So evidence is a really powerful tool for health improvement, and I'm sure that's why many of us who are academics are undertaking research. When I started my PhD in 2002, it was what appeared to me to be, the crest of a wave of the evidence-based medicine movement. There was really broad acknowledgement that much of the clinical and public health practice that was occurring at the time wasn't evidence-based and indeed could be causing some harm, and a lot of optimism about what could be achieved by initiatives like the Cochrane collaboration that really sought to better align research and practice. And I think the decades that have kind of followed since have really shown, how daunting or big this challenge is and how much work there is still to be done. The surveys undertaken in the US and across Europe suggest that between half and 2/3 of public health policies and programs are evidence-based. And I have, I guess, no reason to think that that is likely to be markedly different in Australia. And one of the reasons it's so, such a challenge is because the policy making process itself is complex and evidence is just one, but one component. And to accommodate that complexity, I guess our thinking or our approaches to knowledge translation have evolved over time. And so, whereas initially we saw the issue of knowledge translation as really a problem of policymakers not having access to research to base their decisions on. And if we could only put research in front of them, then surely that would be used to improve policy and practice. We realised that wasn't sufficient, and there was a body of work done on what we call pull efforts. And so this kind of saw the problem of knowledge translation as the capacity or the support that's required for policymakers so that they can search, find, appraise and apply research evidence to address their specific evidence needs to inform their policy or practice. Since then, in particular over the past decade, we've I guess come to undertake or engage in more sophisticated approaches to knowledge translation that have really sought to bring the research production and the policy and practice enterprises together through kind of exchange or what we call integrated knowledge translation efforts. And I think speakers to follow me are going to talk more about what that looked like. what those look like. So today I'm really focusing on these push efforts or dissemination strategies. So push efforts are where knowledge producers, like researchers, actively aim to tailor and disseminate key messages from research findings to an intended policy-making audience. They're informed by dissemination science, which is distinct from implementation science, and I'm more than happy to kind of take questions on that distinction during question time. But the focus on the presentation is really the practice of dissemination. So how can we, what does evidence say about how we can best disseminate research to policymakers and practitioners? So the reason that we're talking about dissemination is that although knowledge exchange and integrated approaches are likely to be far more effective in improving knowledge translation and research uptake, they can't feasibly be undertaken with all potential end users. And usually kind of I see you know, dissemination or knowledge translation efforts as a bit of a dartboard. So in the middle is your bullseye, which is, you know, where you might undertake really comprehensive, intimate type co-production processes with a targeted range or a small number of end users. And the research is kind of designed, produced and disseminated to those end users in a way that will directly inform their policy and practice. And that's indeed the expectation of the co-production process. But around that, at different levels, see a variety of other public health policymakers, practitioners, end users or other agencies that, you know, that could also be interested in your work and might also see value in applying those research findings to inform their health decisions. And really, dissemination strategies is really the only feasible way to reach a number of those stakeholders, particularly when they're kind of international, for example. And so these dissemination or push-based strategies are important for, you know, knowledge translation processes at all levels, but particularly at those more peripheral levels. A couple of things that, you know, to consider when you're thinking about pushing research to public health policymakers and practitioners. First is that, you know, policymakers and practitioners are busy people doing important work. They, you know, they don't need to know about every research finding that you publish, and you need to understand that they are receiving research evidence from a variety of people, you know, not just you. And a lack of thoughtful research dissemination can create confusion amongst end users, can actually disrupt the knowledge translation process. What public health policymakers and practitioners are interested in are research findings that they perceive as relevant, that are timely, so they arrive at a time when they are contemplating a policy decision, and that they're both important and useful. And there's some qualitative research to support that. The quote on the top corner there is, and if I get an article that doesn't sell me that something sort of value, then I'll file it. You know, you need to sell me on what the research article is, and secondly, the research has to be practically orientated. So, you know, what we disseminate needs to really speak to the needs of that end user. The final point here is making sure that when we disseminate, we do it in a way that preserves our academic trust. As researchers, we're seen as, you know, honest brokers, and that is really the source of our influence in the policy making process. I do have some concerns that the reorientation of funding schemes like NHMRC to more directly reward research impact, which is a laudable goal, may have an unintended effect where we have researchers disseminating research to policymakers that perhaps shouldn't be used or shouldn't be the basis of an important policy decision. And I think there is some, at least qualitative research to suggest that might be the case or maybe starting to occur. So some qualitative work with some Australian policymakers and practitioners, you know, one participant said sometimes people, being researchers, overstep their bounds, overemphasise the importance of their research when the evidence may not necessarily support it. And this policymaker is clearly understanding that, you know, they've got a research agenda to support research centres to get funding for, and so is, you know, making a comment there about the interests of researchers and why particular evidence might be being disseminated for them or to them. So in terms of how dissemination should occur, this is the framework Ross Bronson has developed, which we have kind of used to kind of guide our dissemination approaches and indeed inform the framework for research that we've undertaken. I'm going to walk you through some research that speaks to 3 of these attributes. And that is the source, so that we can influence policymakers and practitioners by varying the source of the evidence that's being disseminated, by the message that's communicated to policymakers and practitioners, and how, or the modality that evidence is received. So this was the findings of a value weighting exercises that we undertook with Australian-based policymakers and practitioners. So as part of this survey, policymakers and practitioners had 100 points to allocate across different scenarios based on their preferences. And so here we asked policymakers and practitioners about their preferred sources of research evidence. And what we found was that the primary preferred sources were the researchers themselves who had undertaken the work, or the government or other government departments or agencies. The government departments and agencies finding was actually a little bit surprising to me. I wasn't expecting that, but it is supported by some qualitative work, which kind of illustrates that, you know, one of the number one strategies to accessing and using evidence is actually policymakers calling on their colleagues to see, you know, what they know and what they would recommend, which I think makes sense. Not-for-profit organisations, so industry and journalists, scored the least in terms of preferred sources of evidence. Here we asked about content preferences, so what should a message look like? And so we found that policymakers and practitioners were primarily interested in dissemination forms that include a brief summary with clear recommendations to guide their practice or decision making, and interestingly they were also interested in the data, so they liked statistical summaries. We found that narrative testimonials, which are written about as being likely to be influential, particularly emotive, might be influential in the policy making process, but that certainly wasn't coming up as a preferred format here.
Really brief summary.
Here we asked about the sorts of outcomes that they'd like reported in information that's disseminated to them. Again, we found effectiveness was clearly the thing that policymakers and practitioners were most interested in, followed by equity, feasibility and sustainability outcomes. Right down the bottom there was issues around adverse effects or safety concerns regarding intervention, which again was a little bit surprising given that the evidence to decision frameworks that have been developed, which talk about evidence-based decision making, ask policymakers and practitioners to weigh things like effectiveness with unintended outcomes or safety concerns. So that was an interesting finding. In terms of channel, policymakers and practitioners had preferences for peer-reviewed publications. So they want to see the published form of the evidence that you're pushing to them, as well as reports, policy briefs and plain language summaries. Some divergence between policymakers and practitioners there, but overall they seem to be consistently ranked in the top 4. And finally, we did a study where we followed, we surveyed authors who had published in a Cochrane review or a range of Cochrane reviews over a period between 2007 and 2017, and we asked them whether the trial that had been included in that Cochrane review had an impact, a public health impact, and we looked to see whether there were any associations there between the reporting of impact and the use of particular dissemination strategies by that research group. And it's, you know, these are likely to be, you know, confounded as a cross-sectional study. It's certainly not speaking to causation here, but what we found is that there was some evidence to suggest approaching significance, that media releases and the presentation at academic conferences and workshops were associated with greater impact. But we also found that the use of a more comprehensive range of dissemination strategies was strongly associated with greater likelihood of impact. So in conclusion, knowledge translation is critical to improving public health, and thoughtful dissemination strategies are an important part of all knowledge translation approaches. Based on the work we've done with Australian public health policymakers and practitioners, we've really found that they view researchers as a preferred source of research evidence, and that they prefer messages that are policy orientated, practical and with clear recommendations, and specifically those that speak to the effectiveness, equity and feasibility and sustainability of particular public health interventions or courses of actions. They prefer publications and summaries, brief summaries when communicating research findings. And finally, knowledge translation is more likely to have an impact if dissemination strategies that are employed are more comprehensive. I'll just finish there by acknowledging some of the key contributors to the work that I presented today, and acknowledge funding from the New South Wales Cancer Council. I'll stop sharing there.
Thanks, Luke. So we'll hand over to Alex and Maddie now.
Thanks, Meg. Share my slides. Are you seeing that okay? Great. So thanks everyone. I'm Maddie Heenan. I'm a research officer and PhD candidate at the Prevention Centre in the George Institute, and I'm co-presenting today with my colleague, Dr. Alex Chung, a VicHealth Research Fellow at Monash University. And what we're focusing on is a knowledge synthesis approach that we developed and applied in public health law in my case, and in the first 2000 days in the work that Alex did. And the aim here was to sort of, I guess, address some of the knowledge action gap in policy and research. I also would like to acknowledge the traditional owners of the lands we meet on today, and the Collaboration for Enhanced Research Impact and Prevention Centre acknowledge Aboriginal and Torres Strait Islander peoples as the first Australians and traditional custodians of the lands we live, learn and work. So the Prevention Centre is a collaboration of policymakers, researchers and practitioners working together to generate and disseminate knowledge, research and evidence. And the Prevention Centre is co-funded by multiple state and territory health departments, including, as well as NHMRC, MRFF, Cancer Council Australia and VicHealth. And we recently established the Collaboration for Enhanced Research Impact, the members of which are on the screen here. And it's a joint initiative between us and a growing number of NHMRC Centres for Research Excellence, aiming to enhance the impact of prevention research and identify new ways of mobilising policy relevant research. Our unique model aims to improve the availability and quality of evidence to health decision makers, and it's underpinned by systems thinking and co-production. So central to this is knowledge, translation and mobilisation strategies. We know that decision makers face ongoing challenges when trying to mobilise and translate evidence into policy and practice. We hope that by applying systems approaches, we can facilitate a multi-perspective view on complex phenomena like chronic disease prevention, and can identify who within the system has power and influence and what types of knowledge are valued and used, and Luke really touched on those types of knowledges just before. I guess what we do know is that traditionally evidence is generated and synthesised by researchers, and so to take a more systems approach, we wanted to develop a process where we embedded policymakers and communication experts into the research process. So effectively combining co-production, systems thinking, and knowledge mobilisation and translation. Our process is quite different to a typical systematic or rapid review. So it's an extension of our collaborative co-production work, and each synthesis has the involvement of a research content lead, a communications lead, and a policy lead. So there's a little project team on each of the knowledge syntheses that we've undertaken. The evidence is also selective and drawn from Prevention Centre and CERI research and expertise. So it doesn't claim to be a review of all the evidence in a given area. The emphasis is on identifying, drawing out and synthesising findings and expertise across our programs of work to generate new learnings and insights. The first step in our synthesis was to establish the focus of it. So we drew from key topic areas that our policy partners had identified as being of key importance. So in this case, public health law in the first 2,000 days. The next step was to engage our project team consisting of the research, communications and policy leads. And following this, we held a research policy dialogue to meet with policy partners to present a concise overview of existing evidence and then identify some main policy and research questions. And then the research team goes away and further develops that. And then we start an initial synthesis, undertaking the traditional data extraction processes, identifying relevant pieces of research, and then preparing an initial synthesis of key findings to inform a second policy research dialogue. And in this second dialogue, we jointly consider the implications of the findings for policy, research and practice. And finally, the findings are then translated and disseminated through a variety of research, policy and communications outputs. And Alex will touch on that shortly. So I just wanted to briefly provide a bit of an overview of my public health law synthesis, which was mapping, more of a mapping the literature type of synthesis. And so for this work, we define public health law as encompassing policy, law and regulation. And we conceptualised high-level policy frameworks and strategies like the National Preventive Health Strategy as plans that set the policy agenda. And then public health law is seen as implementation tools to achieve policy goals. So when we refer to public health law, we include legislative and non-legislative instruments. And there's a few in the dot points there. So this includes policies that have the rule of law as well as legislation and regulation. Our research questions from the first dialogue focused on identifying what types of research and public health risk topics were focusing on policy, law and regulation within Prevention Centre research, what the cross-cutting themes are, and the implications for policy, practice and future research. We found 12 projects and 40 publications across the Prevention Centre. And figure 1 here shows the types of research that's undertaken. So lots of regulatory analyses, developing new methods or indicators to support evaluation, investigating governance and policy frameworks, evaluating impact on health or behaviour, perspectives on regulation and some work on industry relationships and tactics. Figure 2 shows the range of public health risk areas that our work's focused on, and the other category consisted of 4 studies that looked at road safety, immunisation or general health and prevention. We undertook a thematic analysis and 5 main themes were identified, which were monitoring and evaluation, political environment and considerations, regulatory design, implementation and enforcement. engagement, collaboration and co-production, and impact on equity and disadvantage. And then just briefly, I wanted to touch on some of the key reflections and implications coming out of our second dialogue. So what our policy partners and the synthesis really drew out was that public health law can provide the rules and frameworks to shape social and commercial determinants of health. Research in this area can help make the case for prevention. There's a wide range of co-production strategies used in public health law research and prevention. And there's ongoing challenges regarding working across sectors in a meaningful way. So I guess this just sort of strengthens some of the conceptual and practical linkages between public health law research and practice. And so I'll pass over to Alex to give us an overview of the first 2,000 days.
Thanks, Maddie. Thanks for the introduction and the overview of the Prevention Centre process. As Maddie said, I'm Alex Chung, a research fellow with Monash University, and I had the pleasure of working with the Prevention Centre on the knowledge synthesis around prevention in the first 2,000 days. Maddie's got the slide, so I'll just ask you next slide, please, Maddie. Thank you. To give people a bit of an introduction, the first 2,000 days is a period in a child's life that starts at conception and runs through to about aged 5. We know that this is a critical stage for a child's health and development. What happens or doesn't happen for a child in this early period of life really sets the foundations for their lifelong health and well-being. So money spent or investments in prevention really are an investment in health and well-being for an entire generation, and in fact generations beyond. So we do try and pitch this notion of prevention in the first 2,000 days as an investment in future health and well-being. The knowledge synthesis process that I worked on brought together a number of key stakeholders who are engaged and interested in the first 2,000 days. It included a team from the Prevention Centre made up of researchers as well as communications experts. It included researchers from early career researchers right through to leads of a number of centres of research excellence whose work touches on the first 2,000 days in some way. And the stakeholders that we worked with also included policy partners from state and territory governments, largely working in health, including in early years and in prevention or population health branches. On the next slide, I'll start to take you through a couple of the key components of the knowledge synthesis process. Maddie provided you with a great overview of each step of the process. I'm going to talk about just a couple of those stages really in a little bit more detail for you. I think one of the most novel parts of this particular knowledge synthesis, much like Maddie's, is that engagement with policymakers. So our first policy dialogue, we really use that as an opportunity to find out what our policy partners needed to know. What did they want to know about the first 2,000 days? And how could we as researchers draw on the research evidence to provide the answers to questions that they had to bridge that research to action gap? So from our first couple of hours talking about the first 2,000 days, talking about prevention and how research can really support policy work in this space, we came up with 4 key questions that guided the process from then on. And these were, what are the benefits of prevention in the first 2,000 days? What prevention interventions are effective and cost effective? And that speaks to one of the points that Luke raised from the theory and the literature earlier around effectiveness. Our policy partners wanted to know how to support implementation and scale up of effective interventions, and how can we tailor interventions to meet the needs of priority populations, touching on another of Luke's points around equity. That was a really important aspect that came up in the conversations with policy partners. So from there, we took those questions into the next slide, please, and the next steps of our work. And that was the actual evidence synthesis or the research synthesis. So with those questions in mind, myself and a couple of other researchers from some of the CREs participating in this sat down and looked at where we could find research evidence that had come from the Prevention Centre and the participating CREs that are part of CERI, that Collaboration for Enhanced Research Impact, coordinated by the Prevention Centre. And you can see the logos down the bottom of the slides there for each of the CREs whose work really contributed to that first 2,000 days knowledge synthesis. From the Prevention Centre and the CRA research, we identified more than 60 peer-reviewed articles that were reviewed with a view to answering the 4 questions that came out from our policy partners. Once that research evidence synthesis component was complete, we took the key findings back to policy partners in that second policy dialogue, or that second roundtable, where we could talk to them and find out what those research findings mean for practice, where there are gaps in evidence, so where there's still questions that policy partners have that haven't yet been answered, and that could really help to inform that next generation of research, our future research questions. And we talked to policy partners about what they wanted to do with the research evidence and with the findings that we were starting to build by talking about the implications of the research findings. The policy partners told us they wanted really key messages that they could use in their work when talking with their colleagues, and they wanted some useful resources, summaries, evidence briefs that they could really take back in terms of advocacy that had evidence underlying it when they're engaging in conversations to advocate for prevention and prevention in the first 2,000 days. And that was where the strength of the communications team, in particular Helen Signey, an excellent science communicator, came in, because we were able to then develop a number of knowledge translation products. And I think on the next slide here, beautiful, here they are. We're so lucky, I think, in this particular project to have the skills and the support of the wider Prevention Centre team, because we've been able to generate some really robust research findings that have been guided by policymakers, but we've also been able to develop some really beautiful resources that we hope meet the needs of the policy partners. There's obviously a report, as there always is with this kind of work, but there's a 2-page synthesis summary and a 2-page policy brief that really mean that there's bite-sized key messages with underlying evidence ready to go for policy partners when they're having conversations about the importance of investing in prevention in the first 2,000 days. Also supporting this work, there's a wealth of information on the Prevention Centre website, including links to all of this work, as well as much more of the research that's underpinned it, and some great podcasts as well that really help provide different ways, I think, for people to engage with the research evidence. We hope that this can really be the start of an ongoing discussion between researchers and policymakers in the first 2,000 days to advocate for prevention. And we hope that this model is really useful for you in your work, wherever you are in that sort of research policy practice spectrum. We hope that the case studies that Maddie and I have presented can provide some insights on new ways to really get that research out there beyond just a traditional systematic review that many of us are used to. So thanks very much, and we welcome your questions at the end.
Thanks so much, Maddie and Alex. So I'll take great pleasure in handing over to Rebecca Golley now. Thanks, Beck.
Thanks. So given that we've all been sitting for a while I get up, take a chance to stand up and have a quick stretch. Just checking that we've got the right, is it the large screen?
That's right, yeah.
Okay, great. So Namani, are you all good? Just acknowledging that I'm presenting on Ghana Yata today. So today, so I'm Professor Rebecca Golley, and I'm the Deputy Director of the Caring Futures Institute at Flinders University. And the Caring Futures Institute was established in 2019 with our Foundation Director, Professor Alison Kitson, who's one of the international leaders in knowledge translation in terms of a particular model of the IPARIS model, or the Promoting Action on Research Implementation in Health Services. And at CFI, we take an integrated KT approach to deliver our vision, which is better systems, better care, better communities for better lives. And today I'm presenting some of the work that I do as the lead of the Healthy Start to Life area of focus within CFI. I just want to also acknowledge that today I'm presenting across a range of projects that reflect the collective effort of my team, and to thank them for allowing me to represent us today. Our research program is focused on supporting child growth, health and development, and we have a focus on caregivers, all of the caregivers or the village that sits around children, and we work across the settings and systems where children and families live, work, learn, eat and play. And I'd like to say hi to the many collaborators and partners that I work with who I've noticed are online today. So I can't remember whether I came up with it, but the sort of premise of my talk was around exploration of the science and art of knowledge translation. And I was like, well, what am I going to be talking about today? But after reflecting on the article that Luke spoke about and the question of the science and art of knowledge translation, I settled on 2 case studies, and this is really the practical application, really taking the theory and the evidence base that's building around effective knowledge translation, and really my presentation is about the reality and sometimes messiness of as we sort of strive to use the theory to really execute evidence-informed knowledge translation practice. So context in knowledge translation, context is queen or king. And so the first case study that I'm using today reflects the work, some work that's been undertaken for NHMRC Centre for Research Excellence between 2019 and 2020 under the leadership of Professor Louise Bauer. And this EPOCH CRE came, sort of arose after a decade-long gestation that started with a research network, the Australasian Child and Adolescent Obesity Research Network, which was a collaboration between most states and a lot of universities across Australia, but people from QUT, U Sydney, New Zealand, Deakin found that they were undertaking RCTs in early obesity prevention at the same time. And that led to a knowledge synthesis project, which has then evolved into 2 CREs. So EPOCH Translate is the next iteration or evolution of EPOCH, and it's funded from 2022 to 2027. The second case study, again, sort of arises experience from a project that has been going for the last 5 years, and it's funded by levy raised from vegetable growers through Hort Innovation Australia. And this project is being conducted as a consortia between CSIRO, Flinders University and Nutrition Australia Victoria Division. And the aim of this project is to develop tools and resources to facilitate an increase in children's vegetable intake. And again, reflects a collaboration of over a decade, dating back to 2008 with CSIRO. And really through this project, we're trying to take a non-health education approach focused on fostering a willingness to try and eventually, hopefully, a love and enjoyment of vegetables, working with the various stakeholders and settings, again, where children spend their time. So through these 2 projects, I've just taken out a couple of examples of different knowledge translation strategies that we've been using within these projects. So the first one comes from EPOCH and now is moving into the dissemination phase in EPOCH Translate. And it's the role of monitoring tools as a knowledge translation strategy, and its use in terms of the stages of the KT process in terms of problem or needs assessment, awareness raising, and how it can be used both monitoring and evaluation, but perhaps possibly also as some screening tools. So within EPOCH, we did a systematic review to try and identify some brief tools to measure physical activity, dietary intake, screen time and sleep. And we couldn't identify any short tools that were sort of fit for purpose for the Australian context and were both valid and reliable. So we used a very vigorous development process where we did some research both in terms of selecting the items around content validity, pre-testing the tools in terms of using some think aloud methodology to refine the readability, understanding and wording of the tool design, and then various studies in terms of testing the validity and reliability of these tools. So I've got here a QR code where you can go and download or access these tools, which we have different versions depending on whether you want to look at dietary intake or movement behaviours and sleep, and depending on the different ages of the children or the population of interest. And I think we developed these tools mainly around trying to aspire to sort of routine and harmonised measurements of these behavioural outcomes through both the research lens, but also a research lens in terms of pragmatic or large-scale trials in community settings, in terms of also making it easier to undertake some of the knowledge synthesis where having similar measurements would make knowledge synthesis easier. But we are also increasingly thinking that the tools themselves could be a way to enhance adoption of evidence-based recommendations through both starting conversations or awareness raising with both health practitioners and also caregivers themselves. And so we are just starting a program of research with Dimity Dutch's PhD, really having a look at how we might be able to use these short tools in that sort of screening and healthy conversation starting type model. I also wanted to highlight the work that Vicky Brown at Deakin has done, where we have just established a core outcome set in terms of early intervention trials to prevent obesity in childhood. Moving now to the VegKIT project and the range of examples of knowledge translation strategies within that program, where we have been utilising partnerships for embedding evidence into existing programs, and also the production of a various number of knowledge translation projects, and also the use of a network or an alliance or a collective as part of our knowledge translation activities. So the first one is using partnerships. So it's I've got some examples here where we've published some protocols of a number of controlled trials that we're doing, where we've developed interventions around supporting long day care services to increase provision and intake and enjoyment of vegetable intake whilst in childcare settings. But probably what I wanted to focus on today is more some of the knowledge translation strategies that we've used within the design of these interventions, which we're just analysing the results of these studies at the moment. And so through the partnership by having Nutrition Australia, who is also running the Healthy Eating Advisory Service across Victoria, we've been able to take our interventions or our best practice guidelines around increasing children's vegetable intake and embed that into a range of online resources that are already being promoted and disseminated across Victoria, with also reach into other states. So we've really been able to fast track that dissemination activity by working within an existing structure. We've also, through Nutrition Australia, partnered with some influencers or big personalities, including Alison Frames. And so what we've seen is that increase in exposure to some of the work from VegKIT aligns with when Alice is engaging on social media, or she does some TV shows on the ABC and other things. So it really helps raise the profile of some of our dissemination efforts through that partnership. Another example is by partnering with Nutrition Australia and the Healthy Eating Advisory Service, what we've seen is when we launched our long day care package in July, within 5 weeks we had over close to 6,500 views on the website, and that was 52% of the website traffic, which for us was a nearly 700 increase drive to our website, and we've had really good click rates. So it's been a very rapid translation and dissemination by having that nutrition services provider central to our consortium. Another knowledge translation strategy within VegKIT is to establish a resource registry where we are trying to foster both research initiatives, but also initiatives that are being used in policy and practice settings to have an interactive online library of evaluated initiatives. And so instead of starting from scratch or developing a program from the ground up, the intent of this registry is to have all of those evaluated and effective interventions for improving children's vegetable intake in one place. And it's a searchable registry where, depending on what your setting is or the budget or the outcomes or scale of interest, you can find things that have already been proven, both in terms of having some confidence that they are evidence-based and they align with some of our best practice guidelines that aligns with the philosophy of VegKIT. This one has probably been harder in terms of getting it up and running. So I will put a shout out to anyone online who wants to go and have a look at the registry. And there is ways that you can both access the resources already on there, but if you've got something that is looking at increasing children's enjoyment and intake of vegetables, there are instructions on how you can have your initiative added to the registry. The final knowledge translation strategy that I wanted to highlight was the use of collectives or alliances or networks as both knowledge exchange but also collective action. And so through the VegKIT project, we have formed what's called the VISA, or the Vegetable Intake Strategic Alliance. And this brings together vegetable growers, government agencies, researchers, not-for-profit agencies and industry, all with this shared purpose around trying to increase enjoyment and demand for vegetables, both children and their families. I think, again, there are some alliances or networks are not something to be undertaken lightly, and there's probably been a lot of work over the last 5 years in terms of bringing the right people around the table, understand the different agendas, and then trying to find those points of intersection where we can have a shared purpose, wrapping around that some governance, and then having activities or projects that we can undertake collectively. And I think that's where the potential impact of networks does exist. And I wanted to highlight a really great review undertaken by Bonnie Wiggins and colleagues at CSIRO in the early days of this alliance, and they've identified the effectiveness of how to sort of establish and create impactful alliances in the public health domain. So in terms of take-home messages around the art and science of knowledge translation, I think for people to, you know, if there are researchers online, the Knowledge to Action framework is a really great place to start, as well as some of the work that Luke touched on today. And it's really around, as part of developing your research from early stages, developing an engagement plan, but then having a number of things that are going to support your knowledge translation activities, which may be an implementation plan or a dissemination and communication plan. I think the other one is to match your knowledge translation strategies to your setting and context. And, you know, I think we are still in the days where, you know, I think what Luke presented is a really good start, and that really having a look at evaluating the different frameworks and strategies to find out what is going to deliver the most efficient and effective impact. And, you know, the knowledge translation is both a science and an art, and not to understate the importance of relationships as being a really central ingredient, and those interpersonal skills, so that knowledge translation does deliver the impact that we are hopeful of. Just like to acknowledge colleagues and also funding sources, and thanks very much. I'll stop sharing.
Thanks so much, Beck. That was awesome. So we're going to hand over to question time now. So I think we've got a couple coming through. Thanks, Alex. Hall, who's asked a question for Luke. Are there different strategies that you would use for policymakers versus practitioners?
Yeah, thanks, Alex. So, I mean, I think we provided a pretty superficial kind of overview of what some of the source message channel determinants of or preferences were of policymakers and practitioners. I think broadly we saw good alignment between the two, but there were a couple of areas of divergence. So policymakers, for example, appeared to be more interested or had a preference for receiving information about the economics of a particular program or intervention, and that's probably because they're largely responsible for funding. Policy agencies are largely responsible for funding these types of initiatives. More so certainly than practitioners who have a fixed bucket of money and then are responsible for undertaking it. We also saw some differences in format. So there was, I believe, obviously policy briefs were more aligned or had greater preferences amongst the policy group, but the practitioners were also more interested in plain language summaries. But I guess I would say on the whole, there was kind of convergence more than divergence between those two groups, at least on the factors that we looked at.
Thanks, Luke. I also had a question for Alex, just interested in knowing when you might suggest using the synthesis process, I guess, that you followed with that embedded policy dialogue over a more traditional synthesis review.
Thanks, Meg. I think that's a really interesting question. A couple of things come to mind in response, but actually others on the line might also have views on that. So I'll share my couple of thoughts briefly. I think, first of all, it depends on the purpose of your review. Sometimes in research we do review the evidence to understand where else we need to be building evidence and generating evidence, and that might be more for academic purposes in the first instance. So sometimes your review might be just to guide further academic type work. But I think if you are looking to conduct a review that really wants to shape policy or practice, then it's really ideal to be talking with policymakers or practitioners to make sure that you're getting the best out of your review. And you're using their insights to guide the questions that you're going to answer in your review. So think firstly about the purpose of the review and what you want to get out of it, and perhaps who you're hoping will use the findings at the end, and that might help. And the other thing I think touches back on a point that Luke raised around timeliness of the review. And I think if we're looking to engage with policymakers with our research evidence, we need to know that they're engaged, and we need to know that they want to participate in the process. So if you've got an engaged group, or there's an issue at hand and a real opportunity to engage, then perhaps that is a good time. But if you're working on a topic that is perhaps not of interest as far as you can find in the policy domain, then maybe it's not the best time to be getting them on board. Maybe there's more exploratory work to be done before you start to get a group of people together to guide your reviews. So they're my couple of thoughts, but there might be other ideas.
Meg, can I just add to that quickly? I just also wanted to say that from my perspective as well, one of the most valuable things of having the embedded policy dialogue is that it kind of also gives you a little bit of that qualitative approach as well. So you can, I guess that's why we were calling it a knowledge synthesis. It wasn't just on the evidence, we were also drawing in their experiences and things as well, particularly for my own, and that having the policymakers reflect on how what sort of work they're already undertaking and how this sort of fits in, and whether they're finding it relevant. And the report kind of writes up a section about some of the things that came out of the dialogue itself that might be a little bit different to some of the more evidence from the actual included papers. So I think it makes it a little bit different. So it probably also depends on what you're trying to achieve out of whatever sort of review you want to undertake as well.
Thanks, Maddie. I just wondered, did any of the other speakers want to make a comment on either of those questions? So the other question we had come up was in relation to the creation of the product as part of your synthesis, Maddie and Alex, and just any advice that you or the team from the Prevention Centre or behind CERI might have in relation to creating such products if you don't have sort of specific expertise in that area.
We were so lucky, I think, to have science communications experts as well as graphic design experts in our projects, and I recognise that that's not always possible. I think within your own teams, first of all, ask around. You never know who's got great graphic design skills, who might be keen to help contribute to developing those sorts of products. It doesn't have to be you if that's not your strength or your area of interest. So start within your team and see what you can come up with. The other thing I think is talk to the people that you're hoping to share the findings with and ask them what they need. In our case study, the policy partners told us that they wanted key messages. So we developed about 8 key messages and just had links to evidence to support each of those. But we didn't, I suspect they're less interested in the report, if you know what I mean. So keep it brief would be my recommendation, and find someone who's got the interest or the skill in making them look pretty.
I absolutely agree, Alex.
Rebecca's got her hand up. I think she's got a thought there too.
Yeah, so I think, also for those of us within academic institutions, again, the sort of art and science of knowledge translation is reaching out to our humanities and creative arts schools. Again, they've been a really valuable source of expertise, but also some students to help out. And the other thing is using some of the work like what Luke presented and other things which we did in VegKIT to actually look at embedding knowledge translation strategies within written resources and websites. So it's sort of layer upon layer of trying to sort of nudge that behaviour change and impact as well.
Thanks, Beck. Well, we're pretty much just at time. I'm not sure, Luke, whether you wanted to just say anything more.
I can just see Helen had her hand up.
Oh. Helen.
Oh, hi. I was just going to say that when it comes to communicating the results, it's not just about the design, it's the key messages that Alex mentioned are crucial. And I think the advantage that we had of the knowledge synthesis process was that we knew what the policymakers wanted. So it's really what we did was just boil down the findings into very clear policy relevant messages. And if you can do that you're halfway there to doing that communication. And just to mention, if you look at the CERI website, there are some tips and tricks and user guides and that sort of stuff for researchers there.
What a great way to finish up. Thanks so much, Helen. And thank you so much to everybody who has joined us today. Thank you to our presenters, Luke, Alex, Maddie, and Rebecca, and also to Rebecca Thompson, who's with us here, who supports these webinars. So yeah, hope everyone enjoyed, and don't forget, if you can, fill out the brief survey to let us know how your ideas on future webinar topics. Thank you.